And I tell you, flu season seems especially rough this year. A lot of people here have had it. Maybe you've had it. Maybe your kids came down with it.
I was one of them, and it was awful. Oregon Health Authority data shows a lot of people were sick with the flu in December, but the season looks to be winding down. Morgan Romero looked at the numbers and took some of your questions to an expert.
The Oregon Health Authority puts out a weekly report on the flu. The data that we have access to is as recent as January 11th. The orange line in this graph represents the percentage of positive tests for influenza. You can see it goes up through November through December, peaking at the end of December. We should also note that influenza B is the predominant virus this season, with A being far less. And then the numbers take a nosedive in January. Dr. Flemmer at AFC Urgent Care says most of the time she can tell who has the flu, but the symptoms are really similar to a cold because it's a respiratory illness. So we took the 4 most common questions about the flu to Dr. Flemmer and asked her those very questions. The first one, how do you test for the flu? Well, Dr. Flemmer says she uses a rapid molecular assay. It detects genetic material of the virus. She uses this stick you see in the video to swab the inside of a patient's nose and then puts it in a solution to test it for influenza A and B. Results come back in about 15 minutes. The CDC says if the test comes back positive, it's likely you have the flu. There are more accurate tests out there done in special labs.
Tests are not always 100%, so you have to use your clinical judgment along with the tests.
I also asked Dr. Flemmer, if your test comes back positive, how do you treat the flu? She says you treat it with antiviral medication for 5 days.
The most common one is called Tamiflu, and it's the sooner you get that going, so it's just a pill, the better. You want to treat it within 72 hours of their symptoms.
So the sooner the better. You also might be asking, how does this year's flu season compare to other seasons, to years past? Well, this season hasn't lasted as long, so that's good news, especially compared to last year when people were getting the flu well into the spring. But Dr. Flemmer says it came on strong and her clinic has been slammed.
Some of the days were pretty much everybody who was seen was the flu.
Okay, and every year we do wonder, how effective is the flu shot? Well, there are so many different types of viruses and they're constantly changing. Scientists estimate which types and which strains will be the most or the worst that year based on what other countries see. The flu shot covers 4 strains, 2 influenza A strains, H1N1 and H3N2, and 2 B strains. We don't know how effective the vaccine is yet this season, but Dr. Flemmer says you should absolutely always get your shot. The flu can be deadly or it can have very serious complications. The flu shot is the best way to protect yourself from getting sick. And if you do wind up getting sick, doctors say it probably won't be as severe.